Greetings and salutations. This is Brian Jarris from Ville Wealth Management. In today's video, we're going to discuss Medicare options if working past age 65. Ville Wealth videos are meant to be educational only. So if you need customized advice tailored for your situation, please reach out to us at villewealth.com. So what do you do if you're going to work past age 65 for your healthcare solution? Well, you've got really two main options and sometimes even a third. So option one would be stay on your existing employer health plan, delay Medicare. Option two would be drop your existing employer health plan, add Medicare. Option three, which doesn't happen as often, would be keep your employer health plan, but also add Medicare. So how do you decide which solution, which option is best for you? Well, let's go through 7 questions that should help. Question number 1, does your employer have more than 20 full-time workers? If they do, Medicare is considered to be the secondary payer to your employer health plan, which would be primary. So you could delay Medicare Parts A and B until you retire or until you leave employment, as long as you have a qualifying health plan. You could also enroll in Medicare at any time during your employment, as well as up to 8 months after retiring or leaving employment. Now, it's best to enroll in Medicare at least 2 to 3 months before you retire or leave employment to make sure you avoid any gaps in your coverage. Now, if you have less than 20 full-time workers, Medicare is considered to be your primary payer, so you pretty much have to enroll in Medicare at that point. Otherwise, you're going to face late penalties for Parts B and potentially Part D. So is there a situation that if you have more than 20 full-time workers, you may consider the Medicare only option? Yeah, if your employer plan is not as good as Medicare or if it's significantly more expensive than Medicare, in that situation, you may drop your employer plan and just go with the Medicare only option. Question number 2, is your current healthcare coverage working for you? So this one's pretty straightforward. Is your current employer plan have better benefits? Is it cheaper than Medicare? If it is, keep your employer plan. If it's not, consider dropping it and go with Medicare. So how do you compare it? Take a look at your existing employer health plan and then compare that to Parts A and B coupled with a medigap policy in Part D or coupled with Medicare Advantage with prescription drug coverages. And then you want to look at your monthly premiums, co-insurance, deductibles, look at your maximum out-of-pocket expenses, as well as your drug cost expenses. And then whatever one is better, has the better benefits, is cheaper, that's the one that you should take a look at. Question number 3, is your employer's drug coverage creditable? Meaning, is it as good as Medicare Part D? If it is credible, you can keep your employer plan, you can delay Medicare. Well, how do you know if it's credible? You can check with your benefits group at your employer. If it's not creditable, then you have to add Medicare Part D. And there's 2 ways to do that. One, you could drop your employer plan, enroll in Medicare A, B, and D, as well as you could do that third option here, which was keep your employer plan, but also enroll in Medicare and get the Part D. So what you would do in this scenario is just enroll in Part A because it's free, and then enroll in Part D. So that way you can get that drug coverage. So that's one example of where you would use that third option. Question number 4, are you currently receiving Social Security? If you have not started Social Security, then keeping your employer plan can make sense. If you applied for Social Security before you turn 65, 4 months prior to turning 65, you're automatically enrolled in Medicare Parts A and B. So probably the Medicare only option is what you'd want there because you don't want to pay premiums for your Medicare Part B as well as your employer health plan. But if you haven't started Social Security yet, but you're going to start it while you're still working, then this is where that third option may come into play. You could keep your employer plan, apply for Social Security, but decline Part B. So just use Part A, no premium, decline Part B, and then you'll be eligible to take your Social Security payments. Question number 5, do you want to still contribute to a health savings account? This one's straightforward. If you do, the employer health option only is your only option. Once you enroll in Medicare, you're no longer eligible to contribute to a health savings account. Question number 6, are you or your spouse high income earners? This is another straightforward one. If you are high income earners, you probably want to go with the employer plan only. so that way you avoid paying the IRMA surcharges on your Medicare Part B and D premiums. If you're not a high income earner, then you can definitely consider the Medicare only option. Question number 7, are you currently covering any of your dependents, like your spouse, for example, on your current employer plan? If you are, then you definitely don't want to drop your employer insurance, because then you're going to lose coverage for your spouse. Now, if you're not covering any dependents, then you can definitely look at that Medicare only option. Now, we went through each of these 7 questions in a vacuum, but you really need to look at all 7 holistically. The best way to do that, meet with an advisor and do a financial plan. So I want to thank you for watching today's video. This is Brian Jarris from Vil Wealth Management. If you want to get a hold of us, you can reach us at vilwealth.com. Thank you and have a great week.